Well, I think the staff, felt a sense of pride in everything that they do. They always have felt that way, and I think they finally kind of recognized that they were being recognized for that pride that they had in their work. They just so focused in on, quality and safety of our patients, and just really a big, huge advocate for pediatric emergency care.
I think one of the most important things about us being recognized for Lantern was just the sense of pride in that the people that received the Lantern Award on our unit were the people that built our unit. Our unit's only 4 years old, and so the staff that started making our unit what it is today were the same people that are receiving the national recognition. So I think that was really important, and most of the wonderful things we wrote about in our Lantern application really were initiatives all led by our staff nurses, which we take amazing pride in.
Yeah.
So.
Well, I went to them, the administration last year in October when we decided that, yes, we're gonna go for this, we're gonna do it. I know it had always been kind of a little sparkle in the back of my brain that we wanted to do this at some point in time, but I just thought that this was the right time. And so I went to them, and they were like in total, complete support of us, and driving home, we wanted to be just, the best providers in this hospital, whether it was inpatient or emergency department. So I just think this was the beginning bridge of that, just showing the community in our, the Chicagoland area that we're serious about pediatric care in our department, in our hospital. So they were in full support of that, and then, we just kind of had a celebration party when they found out that we were the winners, and they knew that we give exceptional care, and they felt, this is just one more way to show what great work we do at our hospital. So
I think too, being part of such a large healthcare system, being a part of Advocate, they've dedicated a lot of energy and focus on pediatric care. We became part of the Children's Hospital a year and a half ago, and that was an amazing step for our organization. And I think that this reaffirmed their commitment to the pediatric population. And our unit also is the largest pediatric emergency department in our system. And so we're in a way paving the way of what can be done with limited resources. Every hospital out there is experiencing limited resources, but we have found a way to take those resources and do something really special with it.
Well, I think there's a lot of things that we've done to, show that, the care that we give and the things that we do. And I mean, we were kind of looking at the application, and it was just like, oh, do we choose this or do we choose that? Because I think once we put it all down on paper, Sarah and I kind of realized, oh my gosh, we do so much that it was kind of hard to choose. But from our patient satisfaction to our innovative thinking of utilizing every resource that we have, whether it's our housekeeping, our registration staff, our nurses, our techs, our secretaries in our department, I think we've utilized every one of those resources in our department to, support and provide, excellent care to our patients. So I think, just utilizing every one of them, and that was really a major factor, I think, in what we've done in getting the award.
I remember when we sat down and when we started this journey of putting together this application, and we're kind of seen as the dyad leaders of our unit, and so obviously it kind of fell on our shoulders to sort of kickstart the process of writing the application. And we asked the help of all of our assistant managers and our Clin 3s on our clinical ladder, and everybody jumped in, and it was amazing to see that teamwork. And when we did that first brainstorming, we were writing down all the great things not even having looked at the questions on the application, what things do we want to talk about? That list just kept growing and growing and growing. And like Becky was saying, so many of those projects, it included every department you could think of, and it always, at the center of it, was staff nurses. So that was something I think that was very special about our application, what was kind of unique, I think. We probably had about 15 people helping our application and doing the revisions, and that was a good show of teamwork as well.
Yeah. When something kicks off in our department, like say we have like a near miss or something that we look at as a potential safety issue, Sarah and I usually are like, we're in the same office, so we kind of bat those ideas back and forth. And between the two of us, I think just things, our staff would come to us and say, hey, we think that this was like something that could slip through the cracks in the future. But Sarah and I just start bouncing ideas off of each other of how we're going to approach this to the staff, how we're going to create this environment where this isn't going to happen anymore, or this isn't going to happen again, or we're going to prevent that event from reaching that child. And I think with both of us, we just kind of go, it's like a think tank almost in our offices someday, really, that we just bounce these ideas off of each other, and it's like, okay, I'll do this, and then she goes, I'll lead it out into the education on the department, and we'll do competencies, and here's our SBAR we're putting out about it. So I think too, in our office, it's kind of, I feel that we're kind of that think tank, and that's where a lot of our ideas on innovation and creativity kind of get their kickstart too. So
that's actually how that Brazil wait timeout came about. So one of the safety events on our unit involved just a mismeasurement using the Brazil tape, and from that we said, okay, this is not acceptable in our unit, and we were brainstorming with one of our assistant managers, and out of that came, okay, well, it needs to be in plexiglass, so that was an immediate step that we took to prevent this from happening again. Second, we decided to institute a Brazil weight timeout. So whenever the Brazil tape is used to get an estimated weight, there's always a timeout conducted by the nurse and a verification of the other caregivers, because in the case that it happened, it was, if someone had stopped in a very stressful situation to think about the weight that they were going with, it wouldn't have made sense, And so since that change came about, we've had no errors involving using an estimated weight on a patient. That's just one small example of how, we kind of come together whenever, we identify something that was either an error or a potential for an error.